it was a kind of chronic surprise, because I was seeing all these patients, accepted, when they were high risk for surgery, so this was amazing. And then among the high risk population, we had some intermediate risk patients, they were not that high risk, but they were considered high risk, but in fact they were intermediate. And so we started to do some studies comparing surgery and TAVI on intermediate risk patients, not randomized, just comparing some different series. And already we could see that the results of TAVI were very comparable to surgery. So this was very encouraging. So then when came the intermediate risk evidence-based study against surgery, partner 2, I was very anxious to have the result of that, but I cannot say that I was very surprised to learn that, the TAVI results were comparable to surgery, because we already had this kind of view, the image was there. And after that, if the TAVI was so good in intermediate risk patients, it was almost obvious that if we were doing a low risk population series of patients, we would have very encouraging results. But I was not expecting that so good result that we had in the partner 3 study. Everything has been always in the same direction. And if I can add something, TAVI has been a new technology that had to start with the worst patient in the world, and this is very unusual. To say that if you take the all innovative technology in medicine, in general, you start with the lower risk patients, and then if it works in the lower risk, you go to the higher risk patients. But here we started with the dying patients, and we moved to the low risk patients, and in spite of that, if you see the curve of satisfaction of the physician, it has always been increasing. There was never any drop in the enthusiasm toward the technique, which is absolutely remarkable. TAVI will continue to grow. If we take the numbers, today we have more than 1.5 million of people done in 80 countries. And this technique is getting more and more democratic. Developing countries now are also doing TAVI in spite of the cost, which is relatively high, for in many places. Because when they compare the cost of TAVI and the cost of surgery as a whole, with the rehabilitation programs and the intensive care units and so on, the cost finally is almost comparable. So even in developing countries, and I know a lot of countries where they are now starting TAVI. So I think that the number of TAVI will keep increasing. And also because of the multiple iteration of the devices, always going into towards an improvement of the device, smaller size, safer, and so on. TAVI is turning into a very low risk, safe procedure, like it's a stent-like procedure, So, the scientific evidences that are provided at the same time with the new devices are also extremely good. And if you put all of this together, extension of indications, not only the regular patients, but also the patients with moderate aortic stenosis, for example, or the stent valve-in-valve procedures, and many other subcategory of patients. TAVI will continue to develop a lot, and then probably we'll reach a plateau within 5 or 6 years.